Digital pathology events are interdisciplinary events by definition because digital pathology is interdisciplinary. But until one of my podcast guests actually asked this question at the Digital Diagnostics Summit, how many of you are pathologists, and very few people raised their hands, I didn't know how low the attendance was. So today, together with my guest, Dr. Giovanni Lujan, a seasoned pathologist, myself, a mid-career pathologist, Dr. Alae Kawam, an early career pathologist, and Nick Best, an online publisher from Pathology News, we're going to be discussing this topic: why there are so few pathologists attending digital pathology conferences. Be sure to stay till the end because Dr. Kawam is only joining us in the second half of the podcast. Let's dive into it. I have special guests here. I have Giovanni Lujan.
Hello.
And I have Nick Best.
Hello.
Nick, say who you are and why did you like this meeting?
So I'm Nick Best from Pathology News, and I love this meeting because it is a new, unique way to network with like-minded people. It's not manufactured networking. It's people who are trying to drive our industry forward, coming together and discussing how to make it happen.
Okay, same question to you, Giovanni. Who are you and why did you like this meeting?
I'm Giovanni Lujan, Director of Digital and Computational Pathology at The Ohio State University. It's my first time here, and definitely I echo what Nick just said. I became an instant fan. I love it the way that everybody has the same goal. Everybody is approaching it from different angles and we learn from each other. It's definitely a learning experience as well as a celebrating experience, so it's great.
So yesterday we had a fireside chat with kind of prominent people in the digital pathology space, and you asked a question that was kind of eye-opening to me because you asked how many pathologists are in the room, can you raise your hands? And I was shocked how few hands were up. Can you comment on that and like your experience in other meetings that are supposed to be pathology meetings? I mean, digital pathology is very multidisciplinary, so it's not just for pathologists, but let's talk about it.
Yeah, it's something that I started noticing at the DPA, which is by definition the Digital Pathology Association. Obviously, you expect to be largely attended by pathologists. However, that's not the case. And pathologists are usually a minority. So it seems like the pathology...
How many people raised their hands?
Yesterday, 10.
10, oh my goodness. And we are like 100. How many people did we have in the room? Like,
I will say probably...
at least 100.
Yeah.
Maybe a few over 100, I would say. But yeah, it's just 10 people, which tells you 10%, and I think that's pretty much what we see in other big meetings that are supposed to be pathology-driven.
Why do we see that? Is that the fault of the event, or is it the pathologists not wanting to come? Do they not have time? Do we need to make more one-day events where they feel they can actually leave the lab for a day, perhaps, whereas 2 days, 3-day meetings, that's a long time to be away. You know, what can these conferences do to attract more pathologists?
That was my point yesterday. The point I was trying to make is that we are getting in general, too compliant about the fact that these meetings are, like we were talking, we're learning from each other, we're celebrating, but we are kind of preaching to the choir, right? Everybody here is already on board, is already interested in the pathologist community, which is supposed to be driving this or be one of the main driving forces, is kind of missing their own party, so to speak. So how do we bring them in? That's the question. And what we should be doing is not just celebrating with the people who are here, but recognizing that pathologists are, to me, are the main factor that it is kind of precluding digital pathology to go to the next step, meaning adoption is not.
I'm going to just adjust the mic here. We have a special handle for the mic, look. Here, we can hold it.
She's so fancy.
It's a pen.
I
for
always-
those who are listening, I put it on a pen.
I always admire her, all the her craftsmanship for this. So anyway, so this is something that we need to keep thinking about, how to target the pathologists to get them to listen, to experience. In my experience as pathologist, I believe that if pathologists try it, they will love it and they don't go back. The problem is that they have set some boundaries that they don't even want to go there. They don't want to listen to it. So that's one of the main.
Where do you insert this? Like, where do you insert it? How? What's your plan for making it mainstream in pathology among pathologists? And let me just tell the listeners, tell the Digital Pathology Trailblazers about another comment that was interesting. That was from a young generation pathologist born in '92. She had a different perspective of first wanting very much to work digitally, and the second sentiment was, but how can I make it happen if I'm just starting? Like, nobody in my organization is going to hand me this digital pathology on my computer. How do I do it? And Nick, I see you want to...
Obviously, coming from a non-medical background, I think about this maybe slightly differently, and I wonder whether labs that have gone digital need to invite young pathologists in to trial, to actually give something a go, because even if they're not at the same lab, you know, like open days, labs should have open days and say to young pathologists, come in, see exactly why we're so passionate about this technology, see why we feel it's our future. And then once they've tried it, like you say, they're going to want to go out. And actually, it doesn't necessarily have to be just young pathologists. Bring in the skeptical, bring in the old generation that is skeptical. Let them see what you see, and perhaps that might just change their minds.
Giovanni, how would you do that? How will you make it happen in the pathology community?
What Nick just said, targeting the skepticals and bringing them to the table and let them experience what digital pathology is about and how much benefits they can find into transitioning now. The sooner the better, because as we were discussing yesterday too, the fact of becoming digital is not just switching a microscope for a scanner. And now instead of looking at under the microscope, looking at the screen, the main benefit is that now we transform those images into pixels and we can analyze it by all the AI tools available. And the more we wait as pathologists to get into that realm, the more it is going to take for us to catch up. So that sense of urgency, I think, it hasn't been established very well. That the general consensus is that, oh no, you need to adopt it because now you have a digital image. But I think the concept needs to be, no, you need to adopt it because that's going to be required for you to survive
And to serve the patient,
as
right?
pathologists in the future. Yeah, to survive in order to continue caring for your patients. Otherwise, pathologists who do this transition will definitely be the ones that are going to take over and replace those pathologists who are not up to date with the digital skills.
I think what would be good is maybe if, I don't know who it's going to be, whether it's CAP, whether it's something like the DPA, we could introduce a mentorship program where not just the young generation, but those that are fully, like yourself, can say, yeah, I can take you through this. I can show you what my digital workflow looks like, because that's another thing that we always hear. They think that buying a scanner is they've gone digital, and of course it's not. And I think AI has almost a little bit become that scanner of the late 2000s, where now everyone's like, well, I've got a scanner, I've got AI, I'm digital, and of course that's not the case. And I think they could do with that education from someone who's been through it. They've been through the adjustment. But of course that's going to take time. But whether someone like the DPA or CAP or US CAP or whatever it is could come in and create a sort of generalized mentorship program, but then it's going to take you guys to be able to do it.
I have a question for Nick.
Okay.
And
then me. They're like taking over my podcast. I cannot ask a question, but that's okay. These are great guests.
We believe here in the United States that we are behind Europe and behind Asia and behind most industrialized nations in adoption. you spend a lot of your time in the UK. Mm-hmm. Tell me, what difference do you see, and what do we need to do to get to the level that you are there? If you believe that that's the truth, that Europe is ahead of us.
So I think it was explored in the fireside chat last night. I don't think it's not miles ahead. You know, the UK isn't miles ahead. I think there is more of a desire for adoption. I don't think there's a lot of pathologists that don't want to adopt. Obviously, the biggest thing, and it's been coming up in this meeting a lot, is how the reimbursement. That's completely different, and that's not just digital pathology. That's all types of medicine, isn't it? You know, in terms of we come from the NHS, National Health Service. We pay our taxes, that pays for it, but we don't have an insurance that then pays for our healthcare. And so actually it's on the hospitals, and it's whether they find the business case to go digital. Whereas here, I think that's a bit more difficult to find that business case.
Understand?
You want to comment on that, or do I have the allowance to speak? Thank you. Thank you. And that was a question as well from this young pathologist yesterday. Like, how can we promote? How can we make it happen, even if we don't have authority to do it? I very much believe in leadership through influence, and that's what I basically started doing online, and that's what you guys at Pathology News are doing. I think everybody here, like you said, Giovanni, we are preaching to the choir in terms of adoption, but on the other hand, we're also troubleshooting stuff. And everybody has a different angle of implementation. I had people in my panel yesterday, the lessons from the trail. People are walking by and waving at us because we are having this impromptu podcast. But my adopters were everybody had a different story. And I believe that, and there was one lecture yesterday by Dr. Ligia Joseph, where she was not really a digital pathologist at her core, but started doing something very patient-centric, doing the patient clinics, explaining to patients their pathology reports, their pathology findings, and then she used digital pathology as a tool to leverage this. So for me, whoever has a mission, whatever that's going to be, online influence, education, leading an institution to go digital, there is an angle for you to go beyond what you're already doing to the outside. So for example, this mentorship, the maybe open days or something like that. What I would do, as somebody interested in digital pathology, if I had somebody who was on the fence but not categorically no, I would maybe try to take them to a conference with me and walk them with me through the booths of my sponsors, who are also close collaborators right now. I know exactly what they're doing. I know how to explain it to people who don't have the knowledge I have. So that's kind of my angle, very much individual-driven promotion of technology. What do you guys think? Nick, I'm gonna start with you because you're in a similar space as me.
Yeah, I feel exactly the same actually, and actually we've heard a lot of team. We're a teaming moving this forward. Actually, I do think we are a team, of course, but we're also a team of individuals that each need to make that step to make it, to help the adoption. At Pathology News, our kind of goal is to empower users to see exactly what's going to be needed. We want to educate them on a digital workflow, on the pitfalls. So we have podcasts, webinars, these sorts of things to help people. But yeah, I think a mentorship program. But again, like you say, I think that's going to have to be. The individuals are going to have to buy in. We need the buy-in from the individuals to say, yes, I'm happy to mentor someone or 2, 3 students or whatever it might be. But yeah, I think individually everyone's got to sort of take their responsibility.
Giovanni, what do you think? Beyond your multiple appearances on international stages and online presence, so you're kind of covering all grounds. What are your thoughts on that?
I think the fact what we heard yesterday from this young pathologist is new in practice. It was sort of not eye-opening, but just a confirmation. Something that we've seen in our own institutions. The new generations are completely set on that they are going to be digital and that that's the future, and they are coming out and populating now the workforce. So I think if we kind of cater to them and empower them to start being the driving force at their new workplaces, that will be probably a big event, or that might tilt the balance, because now in order for these practices to attract this new workforce, they definitely will have to be digital and to be offering this kind of digital AI future. So I think that kind of we've been doing the opposite, right? Trying to target.
Convert the old guys who already love their microscopes.
We call ourselves seasoned pathologists.
Seasoned, sorry. I would call myself maybe mid-career.
But
Mid-career, seasoned, and new generation. These are our categories for today.
I'm just making fun. It's like
I'm making it up.
we, the old pathologists, need to understand that the future belongs to the new generation. So we kind of have to prepare the road for them, and we haven't been doing a good job, right, as a specialty. So now they are coming into the workforce and they are creating those expectations, or they are kind of awakening to the reality that their expectations are not fulfilled by their current workplaces. So I think that will be a good way to do it. Like after I heard this pathologist yesterday, I went and talked to her, and I think what we came up with, plans.
Yeah, let's talk about your plan for Path Visions. He just can you reveal that? If not, that's okay. We can just cut
No,
it out.
I think
Because
I
at Path Visions, all of us are going to be there. Nick is going to be there, Giovanni and me, and we need to do something like a similar follow-up on this one. But
absolutely.
yeah, what did you ask her to do?
We will be the host that the podcast that I usually host. It will
Beyond
be
the Scope by
Beyond the Scope.
DPA, Digital Pathology Association.
Exactly, the Digital Pathology Association podcast, Beyond the Scope. We will be there. Pathology Visions, the DPA sponsored meeting. So we will be there in a little bit like a different format. We'll be doing small on-the-spot interviews. We have our set with.
Let's call her Dr. Kwame. Do you want to join us on our impromptu podcast? Because we're talking about you all the time. Probably your ears are burning. Because we're like
I'll tap out. Bye.
Nick, thank you so much for joining. We are having our new guest. So let's start with the first question. Who are you and why do you like this meeting?
My name is Alae, and I like this meeting because it's a very safe space to share how you feel about digital pathology.
And that was the pathologist who commented yesterday that new generation is different than the previous generations. And I think I think people who, let's say, mid-career and seasoned pathologists often dismiss this as like old pathologists. I think like the feeling is, there is a feeling of dismissal of this kind of, feelings, perception, but this is the new reality. These are the people that are going to be the next diagnosticians of the world. And after COVID, it's different. So Dr. Kwame, Alae, tell us, like, elaborate on your comment.
I think that came from a place of personal experience, but I tend to like reflect a lot. And one thing that I realized was like, we do have to work with leadership, right? Mm-hmm. You can't accomplish anything without leadership. And it is on us to say something, but what's on them is to be receptive to the things that we have. And I want, leadership and, the generation that's basically retiring right now to look at us as an investment. Like, we will basically take on whatever projects that they're working on. We are the future. We're, going to carry on their vision. Now, being clear about the vision, whatever, the new technology is emerging, right? We have to be the ones to be the segue into making things more efficient, making things more sustainable. I'm a huge advocate for wellness, right? Mm-hmm. So digital pathology for me, like when I heard it, first learned about digital pathology and remote sign out, oh wow, I can sign up for my library. That's the way it reverberated with me. Now that's not necessarily the case. I had a mentor who was like, no, digital sign up for me means I can send my cases out faster and get, like shorter turnaround time. I was like, no, why would you do that? I mean, work-life balance is one aspect of it. And the reality is you can't dissociate, the benefits of this technology just for, the patient. Yes, patient care is paramount. I am not denying that. That is extremely important. When a patient gets out of the hospital faster, when they get an answer, that closure for the patient is extremely important. However, I will say there are other benefits. When you do think of like a large company, retention has become an issue over time, partially because, people are leaving, they're not happy, whatever, and we want to talk about burnout. It's a huge conversation. However, when you do introduce this technology and make it part of the standard of the practice, I think I've mentioned before, it's nice to see digital pathology evolving, but I want to make it the not gluten-free option, like make it the standard, not the secondary option. I think that's the vision. I think that a lot of people here agree with that. It's just that how do we get traction for it in places that are less likely to accept this technology, whether it's fear, whether it's fear of wasting money. I mean, that's a very major concern. But I'm hopeful. I do want to say out to leadership, listen to us. We are an investment. We want to learn. We want to work with you. We do see the potential. So, yeah, work with us, and we're here to, we're here to make the dreams come true.
Isn't she great? So this is
the new generation, guys.
So I was previously, before she just happened to walk by,
I think we manifested her presence into this show today.
she has graciously accepted to join the DPA podcast for our production and at Pathology Visions. And yesterday I had an idea after she talked about that we probably would be good to have her co-host with me the interviews. So when I was telling you it's going to be a different format. We're going to, instead of doing long interviews, we're going to doing mini interviews. Some will be prearranged with people, but mostly I think we will just pick out from people walking by. We will be set on the Pathology Visions booth. And the idea now is that we will co-host, so you will have questions from the new generation and from the old generation. So we both will kind of interview our guest from two different angles and see that how our views reflect on reality when we actually do those questions. So I'm very excited about this at the DPA, at Meeting Pathology Visions.
I was going to say.
This will be your host.
I'm actually super excited for it. I think when we were on the call talking about it, I was just like, oh my God, I'm so excited. I had a moment. But I will say, don't be afraid to share how you're thinking. When you have an idea and you feel like, you don't know who's listening, and sometimes the people who are in these spaces actually want to hear things. They actually want the feedback. And I'll say, our generation, we're very fearful and anxiety ridden. I get that, been there, done that. But get out of your head and don't be afraid to share how you feel. That has to come from a confidence within yourself to say okay, I actually believe in this. I see a future in this. I'm going to say something. I am taking a risk, and I'm fully aware I'm taking a risk. However, if it's in the right place, they will be receptive to what you're saying. And I think that, people do want to hear support. We're supporting this movement. You might not feel it locally where you work, but at the same time, you will get support in certain spaces. And I will say, find those spaces where you find the support, make your, connections, network with people. And, obviously friendship is something super important as well. The professional connections are another thing, but it's these places where you find support, and that support can come in the form of ideas. Hey, did you try this? Did you try getting involved? It's actually an unwritten, I don't know how to explain it. There's no formula. Everything in life, we think that there's no formula. You just kind of go with the flow and see how things come to you. And hopefully you will, achieve great things.
I just want to give a context how this all happened. So yesterday I was a host of a panel, and Alae asked a question how do I do it when I don't have authority to make it happen? And my answer was talk about it, learn it, and the next thing that happens, she speaks up at the fireside chat, and the next thing that happens is Giovanni asks her to be the co-host of the podcast at PathVision, the Digital Pathology conference for the Digital Pathology Association. So like you did what you wanted to do within 2 days span by just coming to this conference, and you did it already ahead of time because we connected on LinkedIn, we had a call, and you were like, I already knew you. So when we met here, we were like LinkedIn friends already.
I think if I was the owner or a pathologist, a principal in a group, and I see her, I will hire her right there on the spot, or at least make an offer and try to grab her from wherever she is, because this is what it will drive, and it will kind of, to me, what I think is that it will bridge the gap between generations, having the new pathologists lead the way of what they want, so that the older generations, the seasoned pathologists who are controlling the market right now, understand that we need to create and pave the road for them to succeed and flourish. That it's not only about us, that we shouldn't just be thinking, oh, I'm going to retire in 5 years, 10 years, so I don't want to hear it. I think we need to be a little bit more responsible. That it's not about us, it's about the patients and how the new generations are going to cater to them. And so it was an eye opener for me.
I want to comment on that, and it's, again, it goes back to what I was saying. It's an investment. We are an investment. These businesses need to keep rolling, and you need to make sure that the next generation is prepared, at least with the tools. One thing that I want to share with, I guess, people who are in a similar boat as me is know how to communicate things appropriately. Work on your communication skills. Know the jargon, know the language. If you need to sit down on business type things just so you can get a sense of how people think on the other side, the decision makers, that's an important skill to have. You don't need a higher degree for it, but educating yourself within that space is a very powerful skill. And just knowing how to communicate in general, knowing how to link with people, or don't be afraid to reach out. That's how, I reached out on LinkedIn, and that's how we met. The World Wide Web, right? Don't be afraid to use this web. Don't be afraid to use resources that are around you. We really have a lot of power that we just haven't been conscious of. But we're here, and we're making things happen. So, awesome! Thank you so much. I appreciate it.
Before we wrap up, I want to say this is all happening at the Digital Diagnostics Summit organized by Lumea, who brought here the movers and shakers, as the Lumea people say, of the industry. So we're just it's an impromptu podcast. It's not going to be distributed live, but it is definitely very spontaneous without scripted questions. So to wrap up, guys, what is going to be your next step to advance digital pathology after we go home?
We're going to do our next podcast at Pathology Visions with my co-host. We're going to work on that, and we're going to be going all for it and trying to bring this new, fresh approach to our podcast, to the DPA, now with a voice from this new generation. So that's what we're going to do.
Let us talk offline how I can help, and I help maybe distribute this initiative. How about you? Other than the podcast, what's your next thing that you're going to do?
I'm going to actually talk with my leadership and say, hey, I was at this conference, and there was a lot of people talking, and there's some good stuff that was said. And obviously, I'm going to make it a lot more formal and professional and be a little bit more strategic in what I say, but I do want them to know that we exist, and sometimes you don't have to physically push for anything, but just getting slight exposure, the idea in their head, and just talking about it. Talking about it. Sometimes when you talk about things, people get sparked interest and they realize, oh wow, maybe this can solve one of my problems. Staffing issues is always an issue. For example, we're understaffed. Maybe if we can offer a flexible option for some pathologists or whatever it is, that may be a solution. So thinking in terms of solutions, not in terms of just problems, I think is super helpful. and just to slowly bring things in, I think is what I'm going to do.
That's amazing. Thank you so
What are
much.
you going to do, Alex?
I'm gonna talk to you offline how to create even more splash for the DPA podcast initiative. And I'm gonna go and have this podcast edited so that you guys can share it with people. And everybody who's listening and who thinks digital pathology is a good thing, when it's out, please share and send to those who are like not totally against, but who are on the fence, so that they can hear different perspectives. Thank you so much, guys, for joining me.
Thank you for having us. It's been great.
Thank you so much.
And I wish you a fantastic day, and I talk to you in the next episode.
Thanks so much for joining and staying till the end. It means you are a true digital pathology trailblazer. Let me know, why do you think so few pathologists are attending, and what changes need to happen in the pathology departments for digital pathology not to be optional, to be the mainstream, to be the main menu, something that everybody can benefit from. The doctors, the patients, the hospital administration, and basically the whole healthcare system. So drop the comment below, and I talk to you in the next episode.